Franklin Guillen. I'm a medical assistant here at CBHA.
My name is Debbie Ham. I'm a registered nurse. I've been with CBHA. It will be 13 years come September 1st.
My name is Maria Mendoza. I'm a registered nurse at CBHA. I've been working with CBHA for 9 years now.
Hi, I'm Joe Vela. I'm a medical assistant and I have been working for CBHA for 24 years.
Believe it or not, I've been taking care of my grandmother ever since I was little, that I can remember. My grandma suffers from panic disorder, anxiety disorder, and family history also of breast cancer. So I remember calling the ambulance being very little at 6. Hey, my grandma's had an attack. I need you guys to come pick her up. And then we wait the amount of time and then just have her calm down. And then as soon as I graduated high school, I knew the medical field was something I wanted to be a part of.
I decided to become a nurse because of my son Marcos. One day we were going to California for a wedding, and being at a day before on a Friday, we went to SeaWorld, and I noticed that my son was having a very hard time breathing. I did not know why. He was never diagnosed with anything. We ended up going to Children's Hospital, and at Children's Hospital, he ended up being admitted that day. The care that I received there was amazing. The doctors were really good. The nurses there were outstanding. They never left me in the dark. They were always letting me know what was going on. They were very compassionate with me and with my son through every step of the way. And while in the night when I was seeing my son laying down there in bed sleeping, I remember to myself that I was so grateful what they did to him, that I swore that one day that I would pay back the community for what they did to my son. I mean, they were wonderful, they were compassionate, and that was one of the main reasons that I went into nursing. I wanted to follow up with my child's care, be on it, and as well, the same passionate care that they gave my son, I'm gonna return back that to everybody that walks into this clinic and be as a compassionate nurse as they were to my son and to me.
I landed a position in the business office at Ritzville Memorial Hospital, and there were two things that hooked me into nursing at that job. One of my duties when the ambulance arrived at the hospital, I was to grab my little clipboard and run out there and get all the information I could on the patients in the ambulance, whether it be from them, from their family, or from law enforcement. Since the hospital was right there on the freeway, we got a lot of MBAs that would come in, and the first time a really bad one came in, and I just sucked into it. I saw all the gore and the blood, and I saw how the doctors and the nurses were working on helping that gentleman, and that was the first hook.
Why did I decide to become a nurse? I have always loved to help people, especially interpret for the non-speaking English population that we have around this area.
Just the feeling, the reward you get when you help someone, whether it may be placing a referral or making a call to someone else, hey, we have this patient, that needs to be seen. Just that feeling that, you've done something and your work is valuable. That shows a lot about your character and who you are, and especially the kind of person you are to others.
One of the RNs was sitting at the desk one day, and at that time they wore nursing caps, and there was one on the desk. And I said, Carol, can I try on your cap just for fun? And she goes, yeah, go ahead. So I took it to the nursing lounge and I tried it on, and I thought I looked pretty dang good.
Ever since we had our first child who was born as a microcephalic, I wanted to be a nurse. So I started working for CBHA as a transportation, and then moved myself up to working as a medical assistant, which I love a lot. I enjoy working for CBHA. People that come here as needing medical help, it's always nice to help them and try to see what we can do for them. Working for CBHA, we have a lot of resources that can help these people. We just have to guide them to them. And the people we work for, the company, the co-workers, they're all so friendly and easy to get along with. I just have always enjoyed working for CBHA.
I wasn't born here, but I was raised here from a very small age, and I consider myself now Mexican and white, so this is my community, this is who I love to serve, and this is where I plan to be.